Welcome to Wednesday's edition of COVID-19. Korea's daily tally is up again amid cluster infections, which are raising concerns about a rebound that may lead to tougher social restrictions. Now, restrictions which have also led to dramatic changes at sporting events. We have details on that later on the program. First up, our Kwon So-ah has the broader pandemic coverage. Now, So-ah, let's begin here in Korea.
Yes, Sunny, we are seeing quite a surge in new cases this Wednesday. We have 467 new infections as of 12 a.m. That's around 130 more compared to yesterday. And that also includes 433 domestic transmissions, and those were below 300 on Monday and Tuesday. Now, we are seeing cases fluctuating between the low 300s and the mid 500s in the past week. And the total number of cases here in Korea now stands at 79,311 and the death toll at 1,441 with 6 new fatalities, and over 69,000 people have so far made a recovery from the coronavirus. Now, by region, the capital Seoul reported the highest number of infections today, 188, and Gyeonggi-do province also is seeing a triple-digit figure this Wednesday. Also some 36 infections in Chungcheong-namdo province. Now, multiple cluster infections are the reason for this incline, as new cases were reported at major hospitals, a homeless shelter, as well as at a correctional facility in the capital Seoul, this time the Nambu Correctional Institution.
I see. So with the Lunar New Year holiday coming up next week, I understand the government has announced some measures regarding public transportation.
Right, Sunny. Dubbed the special transportation measures, the government is aiming to decrease traveling as much as possible, and that especially through restrictions on public transportation. Take a listen.
Only window seats will be sold on trains, just like during Chuseok. The same is recommended for buses and planes, and there will be a 50% seating limit on it as well. Toll fees at highways will be collected as was done during the Chuseok holiday.
Antivirus measures at transportation hubs such as railway stations, bus terminals, and airports will be strengthened through frequent ventilation and disinfection and installations of thermal cameras. To minimize contact, self-ticketing services will be available too, and entry logs will be mandatory at rest areas, while eating and drinking at such will be forbidden. Now, this Wednesday, we are also seeing infections and fatalities rise around the world. We now have a total of 104.3 million, almost 104.4 million cases around the world, with over 462,000 new infections reported in just a day, and fatalities here, over 15,000 deaths in the past day. And if we take a closer look at the major outbreaks around the world, the U.S. has surpassed 27 million cases in total, and followed by India at 10.7 million and Brazil at almost 9.3 million. Here, Brazil has 56,000 new infections. And then there's also resurgences in France with some 23,000 new cases, and France is seeing around 2,000 daily infections of the COVID-19 variant from the UK. And those are the updates I have for now. I'll be back with more tomorrow. Back to you, Sunny.
All right, So-ah, thank you. See you tomorrow. Right, now on a slightly comforting note, a recent study here shows children are not as severely affected by the coronavirus. I have Kim Han-il here in the studio with me with details on that. Welcome, Han-il.
Hi, Sunny.
Now, I believe we touched upon this yesterday after the briefing where authorities talked about how minors were affected by COVID-19. Tell us more, Han-il.
Sure, and it appears that minors are relatively less affected compared to older patients. After analyzing COVID-19 cases over the past year here in Korea, health authorities found out that less than 10% of total patients were children and adolescents. Over 75,000 people tested positive last year, and around 6,700 of those were under 18, accounting for 8.9% of the total caseload. Yesterday, the Korea Disease Control and Prevention Agency said that children face a relatively low risk of infection, adding that the likelihood of someone under the age of 12 contracting COVID-19 was half of the national average, including all age groups. KDCA said these findings are in line with the World Health Organization report, which states that children represent about 8% of reported cases, which also tend to be mild and asymptomatic. However, the KDCA reported that COVID-19 took different transmission routes when comparing children and adolescents here in Korea.
Children under the age of 12 were more likely to be infected through household members and their contacts, while those between 13 and 18 were likely to contract the virus through cluster infections and less so from family-related contacts.
Since vaccines have yet to be cleared for use on children, prevention remains our best cure. The KDCA stressed the role of parents, urging them to wear their masks at the workplace and avoid private gatherings of more than 5. Also, more outbreaks were reported in middle and high schools in Korea than in elementary schools. To ensure a safe learning environment, KDCA urged all students to wear masks in the classroom and practice good personal hygiene, adding that students should stay home if they have any symptoms and get tested as soon as possible.
Of course. Now, staying in the academic arena, Hanel, a recent survey shows quite a number of people here in the Greater Seoul area are in favor of school openings.
Right. So according to a survey of 10,000 people living in the Seoul metropolitan region, 6 out of 10 respondents said that they supported the reopening of schools and the resumption of in-person learning. Also, 72% of the respondents said that they are in favor of temporarily closing schools with reported cases rather than a blanket ban on all schools. The online survey, which was conducted on January 27th to 28th, was sponsored by lawmaker Kang Deok-gu's office at the National Assembly's Education Committee, along with 11 other education grassroots organizations.
I see. Meanwhile, Hanel, I hear there are also plans to better support female workers amid the pandemic. Please tell us more.
Sure. So the Ministry of Gender Equality and Family announced yesterday that it'll soon announce new measures to support women who lost their jobs during the pandemic. The Gender Ministry said that female workers were hit harder by COVID-19 compared to their male counterparts, as disruptions in school and daycare systems have forced women to carry a heavier burden of household chores and childcare. Also, a higher proportion of women hold temporary or contract positions, where massive job cuts have taken place amid the pandemic. The Gender Ministry is working with the Labor Ministry to offer consultation services for job-seeking women from low-income families and provide unemployment benefits worth 3 million won, or roughly $2,700 for 6 months.
I see. That's good to know. All right, Hanel, as always, thank you very much for the coverage. Hope to see you again next week.
I'll see you next week.
In related news, grieving the loss of loved ones is a painful plight on its own, but the pandemic has aggravated this emotional ordeal by challenging our conventional funeral practices amid health concerns. Do take a look.
The COVID-19 pandemic has taken a deadly toll of roughly 2.25 million lives. Some 450,000 people have lost their lives in the U.S. alone, which is home to the world's deadliest COVID-19 outbreak. The pandemic has changed the way funerals are held, with many services being scaled down and more people choosing to cremate their departed loved ones rather than burial.
Especially in Southern California, the death toll has been staggering. And the last couple of months, funeral homes have been overwhelmed with families and deceased. It's really catastrophic. As it got worse again, then it got down to really not allowing inside gatherings, not allowing gravesite services where people would gather. So it became extremely difficult to have traditional services and for families to mourn and to grieve. And so it was very challenging. And streaming services were something that were around already, but I think COVID certainly has increased their use.
Funeral service workers who watch over the side of COVID-19 victims that have passed on must take extra care to protect themselves from being infected.
일단 아무래도 이제 감염 문제에 가장 큰 중점을 두고 신경 쓰고 있습니다. 일단 코로나 사망자를 이제 인계받기 위해 음압병동 올라갈 때도 레벨 D 보호복과 N950 그 마스크까지 다 착용하고요. 또 시신을 바디백에 이제 이중 밀봉해서 감염성 안치고에 따로 안치하고 있습니다. 하지만 또 일반 시신하고 안치하고 발인 동선이 겹치다 보니까 방역하고 소독에 신경을 쓰지 않을 수가 없습니다. 지금 상황은.
Strict rules are now in place, governing funeral services for COVID-19 victims to prevent any further infection. According to WHO guidelines, disposable gloves and long-sleeved gowns are mandatory for all personnel handling the remains of COVID-19 victims. The Korean government is strongly recommending the victims' families to cremate their loved ones and to do so before holding funeral services.
코로나19 대응 지침 내에 코로나19 사망자에 대한 시신 처리나 장례 지원에 대한 방침을 규정해 놓고 있습니다. 이러한 법령과 지침은 사망자의 존엄과 예우를 유지하고 유가족의 뜻을 존중하면서 코로나19의 차단과 확산 방지도 가능할 수 있도록 하기 위함이며
Countries around the world have also imposed attendance limits at funeral services to tackle the spread of the coronavirus. In Korea, where 3-day funerals are customary, services have become much shorter and smaller in scale. Mask wearing is the only mandatory rule when the country is under level 1 distancing, but attendance caps are enforced at higher levels, and only family members are allowed to attend funeral services at level 3.
유족분들은 방호복을 입으시고 임종 상태나 사망 이후에 장례 진행 상태를 확인하실 수가 있습니다. 격리자라든지 확진자 같은 경우에는 그 확진 기간이 끝나시고 자가격리가 끝나신 이후에도 장례를 진행할 수 있도록 각 장례식장에서 지금 책임지게 지고 부족함 없이 최선을 다하고 있습니다.
The COVID-19 pandemic has not only changed the way people live, but also the way people grieve for the loss of their loved ones.
Our task is to organize Olympic Games and not to cancel Olympic Games. And our task is to make the Olympic dreams of the athletes are coming true.
Over the past year, we've become more or less accustomed to live sports in the absence of spectators, as authorities call for social distancing at stadiums and arenas alike to stem the spread of COVID-19. For more on this reality and other related matters, I have Dr. Alice Hyungyang-tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Yu Chi-ho from Yonhap News Agency. Hello again, Chi-ho.
Thanks for having me.
Sure, let's start with you then. Let's begin with the wins and losses for sports over the past year in the wake of the pandemic.
Right. I think more than anything else, there was a collective sigh of relief across Korean professional sports leagues at the end of last year at the fact that there were no positive tests at the top level of competitions across all sports. If you look at volleyball and basketball, just because their schedules coincided with the early days of COVID-19 pandemic, their previous season had to be canceled prematurely without crowning champions. But with baseball and football, we're talking about the KBO League and the K-League. Their seasons began a little later than usual, but by the time they were able to begin, they had a lot of eyeballs internationally because, simply put, there was no other league really playing their sport at the time, especially in baseball. So in case of KBO, their games were televised on ESPN throughout the US, Canada, and other parts of the world where Korean baseball hadn't previously reached. So they enjoyed a lot of international exposure in that sense. Same for the K-League. They were able to sell a lot of broadcasting rights to different parts of the world, and they had a lot of exposure as well. So in that sense, it was a major success in terms of getting their names out there internationally. But at the same time, the fact that the teams were not able to play a vast majority of the games with fans in the stands, that affected their bottom lines in the end. But as I said, the fact that there was no major disruption to the schedules and no positive test among the athletes at the top level, I think that alone makes their seasons a qualified success.
Right. Joe, staying with baseball and football, baseball began its spring training, I believe, this past Monday, and football season will kick off on the 27th of this month. I understand there are a number of new rules to abide by.
Right.
Please tell us more.
Sure. Well, with the just starting with the protocols with COVID-19, obviously the masks wearing is mandatory for all individuals involved. I'm not just talking about the players and coaches, team staff members, people working in the kitchens for the players. Pretty much everybody who comes in contact with the team during spring training and during the season will have to abide by very strict protocols, including mask wearing, maintaining safe distancing and all that. In terms of rule changes, with football in the K-League, they will be able to substitute 5 players per match up from 3 from the past seasons. That gives teams more flexibility. It accounts for the fact that there could be some injuries because the schedule's a little tighter, and knock on wood, there could be some infections within the teams. So it gives them a little more flexibility in terms of employing different players. With the KBO, the teams will now be able to reduce players' salaries in case of extraordinary events, including the pandemic. So if they have to cancel a few games because of the situation with the pandemic, they will be able to prorate players' salaries depending on the number of games rather than giving them the full salary. So the players will have to cooperate, obviously. I don't think anybody wants to have their pay cut by any means, but this is a different time that we're living in. So I think they're going to have worked together to make this success once again in 2021.
Right. Is spitting still not allowed in baseball stadiums?
That's right.
Right. Dr. Tan, recreational sports have been affected by the pandemic as well. We have a growing number of people complaining about a lack of physical exercise and psychological repercussions as a result of the former. How have the social restrictions amid the pandemic affected the public health in general?
Right, so research into the collateral health effects of COVID-19, not just due to the disease itself, but because of its widespread effects, is ongoing. And it's actually a very complex issue with many layers of effects that are seemingly on the surface versus what's actually going on, acute effects versus chronic effects. There are actually some silver linings. There's been decreased air pollution. People are staying home more, so they're cooking at home more, which tends to be healthier. There's less community-acquired infections, such as influenza, hand, foot, mouth disease. And then there are decreased dangerous behaviors that are typically associated with nightlife venues. But in terms of the negative consequences, there have been many. Some on the surface have been decreased physical activity, as you've mentioned, increased mental health illness, and increased domestic violence, sleep-wake irregularities, especially with people who are having to study and work in different time zones at home. And then the cascade of these downstream effects are many. Decreased muscle strength, increased mental illness, as I mentioned. There can be mismanagement of chronic diseases because people are not able to get the exercise that they need. This would apply for diabetes and chronic lung disease, chronic heart disease as well. And so it's a very complicated issue, many layers. And just as there are countermeasures against the infection itself, there need to be a whole host of countermeasures to help with the side effects or the collateral effects of the pandemic. And some of these solutions, such as exercising at home or helping people with cooking at home, they are in place, but it remains to be seen sort of what the totality of the health effects will be due to COVID-19 and the collateral effects of the pandemic.
Right. Dr. Dan, under the current guidelines, social distancing guidelines, I mean, that went into effect earlier this week, the curfew of 9 p.m. has been lifted for winter sports facilities and shower stalls have been opened at indoor gyms. What are your thoughts on these eased measures?
Well, you know, at the very beginning of the ski season here in Korea, we had an outbreak at one of the resorts centered in the dormitory of some of the workers. And then way back, more than a year ago, at the beginning of the pandemic, one of the most publicized amplification effects happened in a ski chalet in France. Now, skiing and sledding per se are not high-risk activities because they're outdoors. People are wearing goggles and masks and you know, other face coverings, gloves. But it's the gathering, right? The socializing that happens before and after the skiing at the resorts, the restaurants, and the lodgings that are problematic. Gyms are also problematic because they're indoors. Ventilation can be a huge issue. And because of the increased breathing, you have more droplet production. And that can be in the air, and also it can drop on shared surfaces of equipment. And so disinfection can be a problem as well. So even though you know, there are strict measures in place for how to operate gyms, you know, you can't wear a mask when you're taking a shower. So it remains to be seen whether or not we will see more infections from these kinds of venues in 2 weeks' time, because that's kind of when we start to pick up the uptick.
Right. Staying with sports, of course, neighboring Japan is poised to host the Summer Olympics in less than 6 months, on the 23rd of July to be precise. Now, for more on the fate of this event, I have Kosuke Takahashi live on the line. Welcome back, Kosuke.
Hi, Sunny.
Now, Kosuke, organizers have declared the Olympics will be held even as authorities recently extended a state of emergency in several parts of the country, including capital Tokyo. What is the government's stance with regard to pandemic containment and the summer games, Kosuke?
Okay, Prime Minister Suga said yesterday at the press conference he still intended to hold a safe and secure Tokyo Olympics. But just yesterday, the government extended their state of the emergency until March 7th. In Japan, still thousands of people are being infected every day. And then the number of dead people hit a record high just yesterday. And then the occupancy rate for hospital beds for COVID-19 patients remains still very high. In Tokyo, about 80%. So still, you know, this COVID-19 is a kind of nightmare in Tokyo.
Right, I see. Chio, I believe you have a question for Kosuke.
I do. You know, my question is, what are the chances that we might see the Olympic Games without any spectators in the stands, just to, I guess, reduce the risks of further infection in Tokyo?
I think if you look at the public opinion, more than 80% are against holding Summer Olympics this summer. And also, if you look at the Japan's PCR testing capacity, Japan ranks 139 19th in the world ranking. Japan's PCR test capacity is very limited. And also, Japan, as well as South Korea, we haven't started any vaccine rollout, right? And Japan is the only G7 nation which still hasn't started vaccine rollout. So if you look at this kind of the situation, I think it's becoming very difficult, even though the government say they can do it. One more thing, if we decided to hold Tokyo Olympics, we have to welcome about 15,000 athletes and match officials, as well as the sports judges, as well as the media people. So we are not sure we can, check every people's, the health or doing a PCR test, everybody.
Right. Dr. Dan, I believe you also have a question to ask Kosuke.
Right. So the WHO, they have in place a risk assessment tool for mass gatherings vis-a-vis COVID-19. And according to this assessment tool, the Tokyo Olympics would be deemed a very high-risk event. Now, I know you've done really great reporting on this issue. The Japan Medical Association chief, he expressed concerns about the huge influx of foreigners into Japan because of the Olympics, and also the strain that is currently causing health systems in Japan to be near collapse. I was wondering, as a person who is on the ground in Japan now, what is your assessment of the possibility of holding a safe and fair Olympics in really 5 months' time?
Okay. Please remember, Japan is the most eldest nation in the world. More than one person out of 4 is more than 65 years old. Japan is eldest nation. So we have a very, very high risk of being infected among the elderly people. So we have to be, I think we have to be very careful about the welcoming the foreign people, especially variants have a much more contagious effects, right? Many people are talking about this issue now.
Kosuke, what is the public response to the government's stance of pushing ahead with the Olympics regardless of the events of the pandemic?
Yes, yesterday I participated in Prime Minister Suga's press conference, and I asked this question to Prime Minister Suga, and he avoided to answer to my question. And then after the press conference, lots of the reaction happened on SNS, like Twitter, Facebook. They are in favor of me. So people are really worrying about the risk of the Tokyo Olympics.
I see. All right, Kosuke, thank you very much, as always, for your time and for joining us live.
Thank you. 감사합니다.
Right. Dr. Dan, you were a member of the medical team during the Pyeongchang Winter Olympics back in the year 2018, I believe. Now, based on your experience back then, what are some concerns that you have about the upcoming Summer Olympics in Japan this July?
Well, it's a lot of things are in place, as the reporter said in Tokyo. The variants, they are a huge risk. And basically at this point, I think that we need to think that there is no country that is safe from these variants. And this is an international mass event. So international participants from countries around the world will gather in one residential setting in Tokyo. There will be close contact, and then at the end of the event, they will all go back home. So the risk of seeding is huge. Also, the vaccination timeline just does not match what we need for a safe Olympics. Basically, you want herd immunity, not just in the host country, but around the world. Globally, you want herd immunity. And even the United States, they are not predicted to achieve vaccination in 70% of their population until mid-September. That is far beyond when the Olympics are scheduled to start. So vaccination will be an issue. And then also, people don't realize just sort of how many people are involved behind the scenes. So there are more than 15,000, say, athletes, but there are hundreds of thousands of crew for logistics, for media, for transportation, security. And this is not just counting the spectators. And if you want to have a safe Olympics, then you have to think about their COVID-19 safety in terms of immunity and also the risk of spread. So the Olympics are hard enough to host without the pandemic. And the pandemic is hard enough to control without the Olympics. And when you put these two together, it really is a high-risk scenario.
It's going to be a daunting task, of course. Chio, back here in Korea, please tell us a bit about the preparations being made by our teams here in the country for the upcoming games in Japan, if they take place.
Sure. I think for the time being, the athletes are preparing for the Olympics as if they will take place. The assumption right now is that there will be Olympics in July, and this is what we're going to work for. And you know, these professional athletes, a lot of them professionals, they're not trained to look that far down the road, because they play every other day or every a few times a week. So they're more trained to take it one day at a time. So that's their current approach in terms of getting ready for the Olympics. Now, if you look at the men's football team, they just wrapped up their first training camp of the year yesterday. And the message from head coach Kim Hak-bum to the team was that you go back to your teams and just keep preparing for the Olympics as if there will be the games come July. And everything else, there's nothing really anybody can do about that, right? There's no really guarantee at this point that there will be Olympics, but it doesn't help to sit around and worry about whether there will be Olympics or not. So the message to the athletes, just go and prepare as if there will be games. With the women's football team, they will have to qualify for the Olympics, and they were supposed to actually play China in their qualifying matches later this month, but those matches have been postponed to April. That's another latest indication of how unpredictable things are in terms of the leading up to the Olympics. I think it's a little more maybe difficult for some of the older individual athletes who maybe wanted to make Tokyo Olympics last year as their final Olympics. Now they've had to wait another year, which means they're 1 year older, and their qualification process has been rendered a little more difficult just because they're a little older and there's more uncertainty in terms of when or how these qualifying events will take place. There's about 39% of the qualification spots that are still available for grabs across different sports. So there's also a lot of uncertainty as to when or how those events will take place. So there's a lot of uncertainty, right? But professional athletes, they're, I guess, being professional about that, trying to control what they can control and not worry about anything else.
Right, which is understandable. Dr. Dan, you touched upon this earlier on, but what are the chances then, I ask, because some pundits are saying that the chances of herd immunity paving the way for a successful hosting of the Summer Olympics is still a possibility. Do you share these thoughts then?
I have a lot of reservations about such kind of wishful thinking. Up until this point, the road of wishful thinking has really not led to any positive outcomes in COVID-19. In COVID-19, the wise approach is always to think about the worst case scenario, to consider realistically, and sometimes you have to be very cold in your analysis and just looking at the facts and what we're dealing with. And in terms of the vaccination timeline, as I said, Japan and the United States, they are high-income countries, and I don't think that they are even going to be able to receive vaccination status and we need this by June, because that's when most of the people start to gather for the opening ceremonies 1 month later. I don't think that's going to happen even in the high-income countries. And if you consider all of the low and the middle-income countries that are also participants, we are talking about a fair and equal playing field, right? I really don't see that happening.
Right. Meanwhile, Chio, what is your outlook for the global sports industry this year, including that here in Korea and that overseas?
Right. First off, within Korea, with the KBO and the K-League, I talked about the salary structure and how the teams will be able to reduce salary if it comes to that. Last year, the teams had very brief windows of having fans in the stands. There was a brief stretch in March, in actually summer, and early in the fall, but that was really it. And both the KBO in baseball and the K-League in football, they're very gate-driven leagues, meaning they're heavily dependent upon their ticket sales for the revenues, and they didn't have a lot of that last year. So I guess the big question mark is, can they have a little more this year than last year? Again, we don't know the answer to that, but I think they're going to go ahead, at least start the season on time and really see what happens later in the year. And with the ticket sales taken away from those teams, they really struggled financially. K-League in football last summer, they became the first professional league in Korea to even open up discussions about salary reduction with the players. And the players' union wasn't happy at first, but I think they eventually realized they had to work together with the league to make it happen, to complete the season on time. And I think with some of the club employees, it's a concern for them as well. We saw a lot of cases of restructuring, furloughs with some of the North American teams. Their front office employees were fired or they were let go. We didn't see a lot of that, if any, in Korea yet. But I think there might be some fears that could happen to us in Korea. So I think there's a frustration that nobody can really predict what's going to happen this year. But I think the hope is that things will be a little better than last year. And the fact that they went through the pandemic already last year might be able to help them sort of get over some of the obstacles this year a little better.
Are there any government support for our players to ease their financial burden if there is a cut in salary?
These are, obviously privately funded leagues. So, and the teams are owned by private corporations. And as far as I understand, there's really no government subsidy other than sharing some of the revenues from official sports lottery ticket sales. But I don't think that accounts for a lot of their revenue in the big picture. So it doesn't really move the needle, so to speak. So I think it's going to eventually, obviously, ultimately, it's up to the leagues and the teams to really make it through.
I see. Meanwhile, Dr. Dan, how do you assess efforts being made by those in the sports industry to ensure the health of players and spectators alike amid the pandemic? And what would you propose perhaps to further strengthen such efforts?
Well, it's true that many professional sports organizations have been able to host events in Korea safely so far, and that was through distancing and disinfection. One of the problems going forward might be, when the weather does get warmer in the summer, what are we going to do about ventilation of indoor spaces, especially when it gets so hot and humid? One, potential layer of protection that we could add to this is increased testing of not just players, but perhaps testing of spectators as they come in. I think there was an outbreak here in Korea among children's sports league in middle schools. And of course, if they're in a residential setting, that just increases the risk of spread of infection even more. So up until now, I think the Korean sports organizations have done a good job in terms of protecting the athletes and also the spectators. But going forward, perhaps using a little bit more aggressive testing approach could make the entire process of preparing for a sports match, but also going and watching a sports match a little bit safer.
Right. I spoke about this to Dr. Dan, but what is the stance on vaccines among those in the sports industry?
Yeah, when you look at the athletes, they're some of the healthiest people in the world, right? So you would think that they would be the last ones to be vaccinated for COVID-19. But interestingly enough, just a few weeks ago, one of the oldest serving IOC members, Richard Pound from Canada, suggested that athletes should be among the first anyway, to be vaccinated so that the Olympics can take place in Tokyo. I don't know if the optics will be that great in that case. I don't think the athletes themselves will feel comfortable jumping the line to get the vaccines first ahead of people who might be more at risk for COVID-19. So in terms of the athletes getting vaccinations, I think we're going to have to wait a little more. But I think the availability of vaccines would help sports leagues in other areas in terms of maybe getting some of the fans back. If the general public, the wider public gets vaccinated, it might make a difference in terms of how many fans or when fans will be able to attend some of the games in person. And they would obviously help with the bottom lines of the sports teams and leagues across the country and also other parts of the world.
Right. Dr. Dan, how can members of the public seek to maintain their health despite restrictions and activities outdoors?
Well, fortunately, Korea in general, and especially Seoul, they're very walkable cities and areas throughout the country. And walking outdoors is considered a safe activity as long as you have a mask on and you're with a small group of friends, up to 2 or 3 friends, or by yourself. And so staying physically active is possible in Korea, even under pandemic conditions. And I recommend regular walking outdoors. Other than walking, say if the weather's not good, there are many indoor activities that people can do. Stretching, yoga, there are YouTube channels that you can watch, also exercise DVDs that you can put in. dancing to music is also something that you can do at home. So there are plenty of options. It's just a matter of, having an open mind and fitting it into your schedule, making it sort of a requirement of your day, not as something that you'll do sort of as an option. If you do these activities, say, with your family or with 2 or 3 friends, it makes them fun and not just addresses your physical health, but also your psychological well-being, which is so important in the pandemic as well. Just that level of interaction, even if you have a mask on and you're distanced, just knowing that someone is there and that you're enjoying an activity together, I think will make people feel just more calm and have a happier outlook on their life and the pandemic situation.
Right. Chio, just out of curiosity, does an absence of spectators at stadiums or arenas alike lead to a loss of home advantage, in your opinion?
I think so. I think there might be even some evidence that the home field advantage has been taken away from some of the teams. It's not really scientifically proven, I don't think, but athletes talk about feeding off the energy of the crowd and how at first it was pretty weird to have so much silence in baseball stadiums and football stadiums when they were used to hearing chanting and noise and all that. So I think it took a while for the athletes to get used to it. But on the other hand, some of the younger athletes, we're talking about rookies coming out of high school who've never played before, 15, 20,000 people. I don't think they really minded some of the quiet surroundings because they weren't as nervous. I think they would have been with 25,000 people who are cheering against his team,
right.
Cheering against him. Whereas, he didn't have anybody in the stands anyway, so he could just go out there. Young pitchers and young players anyway, they could just go out there and then perform.
And focus more on the game.
Right, focus more on the game. So I think it helped in different ways for some of the athletes.
Right. And staying with that, Dr. Dan, there are some pundits who claim that spectator euphoria that is experienced at live games is essential to ensure people to overcome tough times. What are your thoughts on this?
I am all for sports and their ability to bring people together and to, sort of get all the stress out, right? When you're cheering for a team, people feel united, people feel, especially when your team wins, there is a euphoria, definitely. I would love to see the Olympics take place. The biggest concern, though, is the goal of the Olympics are to make a world a better place through sports, through fairness and equality. At the end of the Olympics, say if they are held under this very stressful conditions and say they do act as an amplification event, will this actually help the world be a safer and better place? I don't think so. And I don't think that that's a risk that we should take. If they have a spectator-free, say, Olympics, perhaps that will decrease the risk. But still, there are more than 10,000 athletes that need to be taken care of. And the risk to the individual athlete, of course, as well, if they were to get COVID-19, if they were to get pneumonia, if they were to get chronic COVID, the health risks to them are also very high. You mentioned older athletes. I think the oldest athlete is an equestrian who's 65. That person is in a high-risk category. We have to think about these older athletes' health as well. And so if we look at the net benefits and risks of holding the Olympics, I think at this point, the risks outweigh the benefits, not just from a health perspective, but also from the perspective of, as you're mentioning, are there alternatives, for having an online event, or there are a lot of electronic sports events that are being held. Can we convert it and make it a safer event? I think so. So these are all things that we need to consider. But as it stands, I don't think it's a safe proposition.
I see. All right, Dr. Dan, as always, thank you very much for your insights. And Chio, thank you for being with us today. Right, a recent local study shows one can transmit the coronavirus for as long as 12 days from the onset of symptoms. So do seek to get yourself tested if you believe you may have been exposed to the virus. In the meantime, do take care. See you tomorrow.